Sawasdee krap. Good afternoon once again. Today is Tuesday, the 29th of June, 2021. And this is the English language summary of the daily press briefing here at the CCSA as always. So it's a pleasure to be back. In the past day, on Monday and Friday, we had Director Pen Som from my office, the Ministry of Foreign Affairs, to come and give you the English language briefing, to alternate with me for some days. Now, thank you first also to Dr. Tui Sin for the Thai language briefing just now. Dr. Tui Sin talked about a couple of important issues. Firstly, I'd just like to touch upon what he mentioned about the construction sites as per announcement number 25, in particular, item number 2 in announcement number 25 regarding construction sites. Now, in that item, it mentioned about the prohibition of large-scale construction activity at construction sites wherein there are more than 20 workers working in the construction site. So that is prohibited in the dark red zone area. Now, there was a question that came about yesterday regarding the house renovation projects or shopping mall renovation activities. Would that be allowed? Now, the answer is yes, that is allowed if it does not exceed 20 persons in terms of the construction workers. So the purpose of number 2 of announcement number 25 that was announced regarding the various measures is intended to prohibit large-scale gatherings of workers, construction workers, in large-scale construction sites, like, for example, construction sites with 100 plus or 200 plus construction workers. So therefore, if you have house renovation projects at home and at one time the construction workers do not exceed 20 persons, that would not be a problem. So Dr. Tui Sin addressed this yesterday in the evening after the briefing during the daytime. He also mentioned about some updated information regarding old and new clusters in Bangkok and surrounding provinces, as well as the progress of the existing clusters as well. There are 3 areas which were of focus and which were being analyzed on the risk factors. The first is, of course, crowded communities. Second is markets. And third is construction sites. Now, of these 3 areas, it was found that the markets remain of the highest risk. They are the area of the highest risk in Thailand. In Bangkok, in particular, 32 markets have already been tested for COVID out of the 87 markets that are of target. And out of the 32, 6 were found to have COVID positive patients. So the mission to test all of these risk areas continue in Bangkok. And we, of course, have to be very mindful of the measures and all the prohibitions that have been announced for Bangkok and the surrounding provinces. So let's start with an update on the number of vaccines that have been administered since the start of our vaccine drive. As of yesterday, the 28th of June, Thailand has already administered a total of 9.4 million doses. To be exact, you can see on screen 9,416,972 doses of vaccine in total. Now, we have the daily number, as you see there, 271,000 for yesterday. Out of the over 9.4 million doses in Thailand, around 6.7 are those who have received their first, 6.7 million, those who have received their first dose, and 2.6, almost 2.7 million, having received their second dose already. So this brings us to an equivalent of over 9% of the population and close to the target towards the end of this month of June, where we hope to have approximately 10 million doses in Thailand already. This in turn means that the inoculation drive has covered 29% of those residing in Bangkok, while the national average for other provinces is now currently at around 5%. But we hope that the number will be increasing in the months ahead, if we are at this pace, at the rate that we are going, I believe that we can reach our target, at least for June, 10 million, and for July, the other targets that are set for July and the months ahead. Now, yesterday, AstraZeneca issued a statement mentioning that the company was on schedule to meet its commitment of supplying vaccines to Southeast Asian countries. After some initial delays in the production and in the delivery, it said that it will have completed the agreed quota of 6 million doses for Thailand within this month, while export to other Southeast Asian countries will commence in early July. And Siam Bioscience is expected to produce a total of 180 million doses of AstraZeneca this year, just over a third, 61 million doses for Thailand, and 2/3 for other countries in Southeast Asia. So let's now turn our attention to today's figures. We have new recoveries today at 2,793, making the total recovery in Thailand, number of recovered persons in Thailand, 205,062. As for the new confirmed cases, we have 4,662. You can see that on screen, making the total number of confirmed cases since the very beginning at over 250,000 cases, 254,000 cases. Out of this number, 47,481 are from active cases, and 1,846 remain in critical condition, while 527 are on ventilators. We have, unfortunately, fatalities to report at 36 fatalities, making the cumulative fatalities in Thailand now at 1,970. For the overall situation in terms of the province distribution, on screen coming up soon, we'll have a slide on the top 10 provinces which reported COVID cases yesterday. Bangkok being on top, number 1 at 1,692, followed by Samut Prakan at 647, and other provinces around 200 plus, around 200, 100 to 200 plus, following the Samut Prakan, which is Samut Sakhon, Nonthaburi, Songkhla, and the other provinces, which you can see on screen. Small clusters have also been detected in factories and businesses in Bangkok and peripheral provinces, partly because of the active case finding missions carried out by the public health authorities. Now, new cases of infection detected in walk-in patients continue to be identified both in Bangkok and other provinces, most with confirmed contacts with those who tested positive. I'd like to provide you some information on another issue regarding just briefly on the latest economic relief package, wherein the Prime Minister met with the economic team yesterday and discussed various economic relief packages for those affected by the new curbs, the bans and the prohibition in Bangkok and 5 adjacent provinces in particular. So a 7.5 billion baht relief package will be allocated to alleviate the plight of those affected, especially those working in restaurants, eateries, and construction businesses. Now, of course, obviously, these sectors are affected by the most recent measures. In Bangkok, dine-in being prohibited once again, and for construction businesses, large-scale construction sites that would have to be on hold. So obviously these sectors are affected by the most current ban, and this economic relief package is aimed to address this issue. So this covers employers and employees both in and outside the social security system. The exact details will be announced shortly, and they have to be duly approved by the cabinet as well. And there's a cabinet meeting today, on Tuesday, which is today. So we'll hope to hear more about that. Also, just a piece of information regarding Sinovac, because in Thailand we have used Sinovac from the very beginning as the main vaccine to start with, aside from the other brands. Now, Sinovac jab up to 91% effective after a double dose. So that's the headline. So in detail, the Public Health Ministry revealed that its study that two doses of Sinovac vaccine are up to 71 to 91% effective in warding off infection in the alpha strain, which is the strain, the variant first detected in the UK. The subjects of the study were those from high-risk groups in Phuket, Samut Sakhon, and Chiang Rai, as well as public health workers. And the vaccine was found to be 90.7% effective in the Phuket subjects, 90.5% in those from Samut Sakhon province, and 82.8% effective in people in Chiang Rai province. The results are also show that the vaccine was effective in lowering the infections among the public health workers by 70.9%. So just a reminder that we have the English language summary for you on weekdays now, Monday to Friday, none on weekends. On the other days, which we don't have a broadcast, you can find information through the various English language social media pages, the Foreign Ministry, the Public Health Ministry. Please, of course, get information from sources that are official. There are, of course, a lot of things going on social media, being distributed, circulated on social media, which may not be exactly accurate. So we have to be careful about that from time to time. I'd just like to show you an infographic by the World Health Organization suggesting to avoid crowded shopping centers and doing online shopping and during the recent surge of COVID. Of course, we have to be careful when going to the various restaurants, which of course now it is not permitted to dine in Bangkok and 10 provinces. So therefore, ordering food online, ordering takeaway, and doing home cooking would be a very good alternative for everyone right now. So thank you very much for your kind attention. Please continue to stay healthy at home. You have an infographic there on screen for you. And then with that, thank you for your attention and we'll see you again tomorrow. สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐพานุ นพคุณนะครับ